Hello. Just getting started here. Hi.
Hello.
Oh, yay. I'm so glad I figured it out. That was actually really easy.
Oh, good. Okay. I was worried I
Awesome.
was going to miss it.
No, you're good. Can you hear and see me okay?
I can hear you. Can you hear and see me fine?
Yeah, you are good.
Awesome. Okay.
Okay. Well, hello, everyone. We're going to go ahead and jump in. Do you want to go ahead and introduce yourself first?
Yeah. Hi, everyone. My name is Dr. Bianca Moret. I am a part of Carolina Functional Neurology Center. I am one of our doctors in our Raleigh location. I am a board-certified chiropractic neurologist. I practice functional neurology and functional medicine here. And I wanted to team up with Sarah. I've been following her for a long time, and I absolutely love her content about anxiety. And this is a topic that I'm very passionate about as a provider because I have the honor of treating so many patients for a variety of conditions, but a lot of them get kind of misjudged as anxiety. And so I love Sarah's content, especially how much she talks about the physiological responses of anxiety. And I had to reach out to her and request an Instagram Live so we can talk about it.
Yeah, for sure. Awesome. Cool. Well, I'm Sarah. For those of you that don't know me, I'm an anxiety therapist. I see clients in California, Utah, and Florida. And I pretty much just specialize in all things anxiety, all types of anxiety disorders, really being able to differentiate between if it is anxiety, if it is something else. And so I was really interested in doing this Instagram Live because I think it's so important. A lot of people have, and I'm sure people that are listening can probably relate to this, a lot of people unfortunately have been kind of had their symptoms like written off as just anxiety when there could be something else going on. And I know that personally I've had that happen to me as well. So I think it's really important to just get differing like expertise on this, and functional neurology unfortunately isn't as well known as just like Western medicine. So I think it's really important for people to know that things like that are available to like help you figure out different symptoms.
Love that. And we are going to kind of go through some topics and like things that could be causing anxiety. But if anyone kind of tuning in and watching has any, additional questions about what we're talking about, please like send a message through this and we'll try to get to it as we move through.
Mm-hmm. Yes, for sure. Okay, awesome. So we were going to start with like, how do I know if the symptoms that I'm experiencing are from anxiety or from something else? So I'll speak a little bit to kind of like what I recommend my clients do, and then you can jump in, Bianca. So every client that comes to me that's experiencing anxiety, I always recommend that the first thing that they do before we even really like get into it from a therapy standpoint, especially if the anxiety came out of nowhere, is you want to make sure there's nothing medical going on. So going to get a physical by your doctor, getting blood work done. There are a lot of different medical conditions and medical things that can mimic anxiety symptoms, which we're going to get into in a minute. So that's kind of like number one, is before we start just trying to like work on the anxiety, we need to make sure that it's actually just anxiety that's going on and that there's nothing else underlying that could be going on. So do you want to speak to some of kind of the main things?
Yeah. In kind of the realm of functional neurology and functional medicine, we are looking at when someone comes in and says, I have anxiety, we're looking at that. Obviously, if they've been given that diagnosis, that's extremely important, but also we're looking at it as a symptom, not just the diagnosis. And kind of to your point, like ruling out anything, first off, pathological, which could be anything from an adrenal pathologically reason. So like a tumor on the adrenal glands, anything like that. But that presents a very specific way. But then there's these other areas where we're talking functionally speaking, such as blood sugar dysregulation, vestibular dysfunction, autonomic dysfunction, and other things that the brain has a hard time understanding where it is in space, or it has a difficult time controlling our autonomic nervous system, which is our fight and flight and rest and digest system. And those are, and in addition to that, thyroid issues, in addition to that, other blood sugar and adrenal issues can all be compounding. It can be multiple things happening in one person, or it can be just one thing for one person, but it can mimic anxiety. And the things that I like to ask my patients on, I call it the body anxiety. Mm-hmm. We obviously never want to split psych from the body, but for a brief moment, I just say, does it feel like if you're not doing anything, if you're just resting on the couch, if you're just hanging with your friends or hanging with your family or watching a movie, and you feel anxious. Like your body feels anxious. Maybe psychologically there's nothing happening, or you're not thinking about anything, or you're not necessarily stressing over anything of that nature. But physically, you are having those physical manifestations of anxiety. To me, as a clinician, that is saying we need to take a deep dive into what is happening.
Mm-hmm. Totally, totally. And kind of on that note, we had somebody say in the comments that their anxiety was coming from like mold toxicity, heavy metal toxicity, hormonal imbalances, leaky gut, candida, hypothyroidism. Like all of these things can absolutely play into that. I have a family member specifically that she, out of nowhere, when she was in her 30s, she had never really had anxiety, like maybe situationally, but like nothing out of the ordinary. And all of a sudden was having panic attacks like all day, every day. Like a traditional panic attack really only lasts from like 10 minutes to maybe like 30 minutes at the absolute most, but usually not even that long. So if you're feeling like you're in complete panic all day, every day, there's typically something else going on that's usually not just anxiety. So this family member was having this happening for like weeks and weeks and weeks and couldn't figure it out, and went to a therapist, and they were trying to work through it. And then the therapist was like, I really think you need to see a doctor. Like, I think there's something going on. And it turned out that she had extreme hyperthyroidism that was causing it. And so she got on thyroid medication, and then like all the anxiety went away. So super important. Make sure you're rolling these things out.
Huge. Another one is concussions. That is a massive one. I think I saw someone post about that. Concussions are a big one. Oftentimes they can deal with a lot of mental health issues after a concussion, and it's because of the inflammatory cascade that happens through the brain, the effect on the adrenal glands, the effect on the thyroid post-concussion, and they can have a huge toll on their mental health. But in addition to that, because we have to address that, especially when they're returning to play or getting back into school or whatever the situation is, sometimes they need that additional support. But we have to rule out or rule in, I should say, other things that have been impacted from a concussion as well. That's a big one that we see. And in our offices, we see a lot of autonomic dysfunction, autonomic nervous system dysfunction, where some individuals will sit in this fight and flight state all day, or for large periods throughout the day, or even when they go against gravity. And some of them do develop dysautonomia. Some of them are more so in the gray area of just having autonomic nervous system dysregulation, and they're kind of sitting in that realm. But either way, they get told quite a bit like, oh, you just have anxiety. Like, it's just anxiety, when in itself, and even in your profession, like there's so much more to anxiety than it's just anxiety. And then even on my side of things, there's so much more that can be causing that as well.
Absolutely. Yeah. And personally, I can speak to that too, because I started experiencing anxiety from a very, very young age. I share this with my audience all the time, is like I started feeling it when I was a kid. And as an adult, I've gone through random health things where I'm like, this is not just anxiety. Like I can just feel it, like a hormonal imbalance for a while. My hormones were like all out of whack. And I knew that there was something off, and I know that there's like, I could tell the difference between like, okay, this is just anxiety. I've been dealing with anxiety for like 20 years versus this is actually something else. So I think it's really important for people to always advocate for themselves. Like if they feel like, if you didn't go through a big life transition or a big life stressor recently, and you just feel like all of these symptoms came on out of nowhere and there's like absolutely no logical reason behind it, then it's good to get that checked out and just make sure and see like it could potentially be something else going on.
Yeah, piggybacking off of that, if someone's had a recent, again, head injury is a big one, viral load, right? If they were recently ill, whether it be from COVID, whether it be a random flu, whether it be any sort of illness of any kind, and all of a sudden these anxiety symptoms have amplified or even began after that, we want to understand what else is physiologically causing this anxiety. Something I just want to put out there, like fainting, passing out is not normal. I've been told by so many patients, it's like, oh, you're just anxious. That's why you lost consciousness. Like, it's okay. You just need to go see your therapist and go get on, SSRIs or whatever it may be. And that person may need to do that, but also like passing out, losing consciousness, seeing stars when you stand up, or, walking to the bathroom, your heart's going through the roof, like racing and pumping through, like not normal. So like we always talk about like what's normal versus what's common. And that's something that they're like, yeah, you know, you're just anxious, that's normal. And it's like, I don't even think someone with, depending on how severe their anxiety is, I don't even think that's even in the realm of normality with the anxiety in general, to lose consciousness, pass out, and hit their head or anything, right?
Yeah.
And so even at that point, it's like, yeah, we might need some counseling or like some therapy for anxiety, but we also need to take a much deeper dive into what is causing.
Absolutely. Yeah. And I have a lot of clients that come to me that do have anxiety. Maybe they don't have something else physiologically going on, like they're not passing out, but they have a fear of passing out. So like when you get panic, you know, feel like you might pass out, you're hyperventilating, your heart rate really speeds up. And so I explained to them from a physiological standpoint that if this is truly a panic attack and this is anxiety and there's nothing medical going on, that it's not impossible for you to pass out. Like if you have an extreme fear of passing out, it is possible that like your cortisol goes so high that that could happen. But it's the likelihood is very, very low, because when you're having a panic attack, your blood pressure increases. And typically when you pass out, your blood pressure is really, really low. So I like to explain that to them, and that can really help them to see that, like, you know, if you're not, like, if you're afraid of passing out and you're having panic attacks, that like, if it's just a panic attack, you're probably not going to pass out from it. If you are passing out from it, that could be something else.
We're dealing with something more.
Yeah.
Yeah.
Definitely.
Yeah. Another one is hormones, females specifically, hormones like postpartum, or just around cycles. I would just say like menstruating females, like this is huge on how much effect the brain goes under during our cycles, and like what happens with our neurotransmitters. Obviously that can amplify anxiety, even at baseline can amplify that, but also like knowing and helping to know when are we dealing with maybe a hormonal imbalance. I like to explain hormones like a symphony, like sometimes during the cycle this part goes up and that part goes up and some parts go down, stuff like that. And that's within the realms of expected and normal, but I think we're kind of fed this information that we should feel anxious, we should feel bloated, we should feel bad, we should, you know, be a completely different person going into this phase in our cycle, when in actuality, like, that isn't always the reality, and or it shouldn't be the reality of people's situations and diagnoses of like PMDD, and saying like, yeah, well, I have it. And a lot of women come in and they'll just say, yeah, well, I have PMDD. And I'm like, well, that shouldn't be normal. It's not normal. Sorry. It's not normal. It's very common. And that shouldn't be taken as at face value, saying, oh, I just have PMDD, or I just have anxiety. And like, just to go, well, why don't we figure out what's going on with your hormones? Or to that person who said they had mold toxicity, like that can directly impact hormonal regulation, including thyroid and adrenal hormones. That can be causing women to have a hard time through their cycle in general. And then especially like postpartum.
Totally. Yeah. And I think that it's difficult because, you know, Western doctors are not trained in this way, you know, like they'll make sure that you're not having a medical emergency, and like they're great for that. And obviously, like, no shit on doctors, like they do wonderful things.
Yeah.
But when it comes to stuff like this, you know, like things that might not be extreme enough to like show up on their testing, you know, like if you don't have that tumor, or if you don't have like blood work that's like off the charts, like extremely, you know, abnormal, then they're typically not trained in like treating that, you know? And so people usually need to go outside of that traditional medicine in order to get that help.
Yeah, 100%. Like lab, it depends of the lab work, it depends of the company, it depends on, so this is, you know, very general, but you know, lab work is standardized to a very specific demographic. Like those values that you see in lab work, obviously if they're in and out, like, yeah, that means there's something going on. But, you know, they're standardized to a very specific demographic, and not everyone fits that demographic to say like, oh, between this level and this level, like you're fine. And so if for anyone who's kind of like, I don't understand what functional neurology or functional medicine is, you know, we take those parameters, that high and low, and we really tighten them up, and we get narrow with it, and we understand like you may not be necessarily like high or low, but you may be kind of within this gray area. And I like to tell my patients that just because you're in this gray area doesn't mean that there's nothing wrong. And that's something else that kind of, you know, also feeds that fire, is saying like, well, you're fine. It's all in your head, right? Like, we're in this gray area. So I kind of say like, you know, the medical community is more so like you either don't have a diagnosis or you do. And those boxes are like right next to each other. And I like to explain to people what the functional community does is we split them up, and that there's this whole gray area in between having a diagnosis or not. And we have to understand, like, do you actually have that diagnosis, or is everything actually doing okay? And like, do we have to explore other options? So I feel like there's so much.
Yeah, they're definitely. Yeah. And I think it's important too, from like a psychological standpoint, is like, even if you do have something medical going on, this is kind of like what I help a lot of my clients with if they're struggling with like health anxiety, is like, how can you still live your life, and how can we help you still feel like you're able to like function and go about doing everything that you feel like you want to do and need to do, even while you're tackling this medical thing. Because with health anxiety, if you have something medical going on, that can just take over your entire headspace, and that can take over your entire life and make the anxiety so much worse. So I help clients a lot with that, of kind of like the mindset of like, okay, like we figured out that it's not just anxiety, and now maybe you have anxiety around what the health thing is, but like, how help you work through that kind of a thing.
100%. I love that. And that's why, I mean, working with providers like yourself to help our patients as they go through treatment. So again, like, we are getting to the root cause of that physiological response, and we're addressing it with neurological rehab if it's neurologically based. If it's more metabolically based, which means like from thyroid or adrenals or other reasons, or hormonal, we obviously address that differently. But if someone is needing specific neurological rehab to help retrain their autonomic nervous system, or help retrain their vestibular function, or what have you, to co-manage with practitioners like yourself who, you know, have awareness of like what we're doing, and like co-managing simultaneously so that the patient is supported on both fronts. And oftentimes, like, patients, when they come in, we're the last stop. Like, you know, they've exhausted other things, they've been neglected, or they've been told by a series of providers, yeah, you're fine, nah, it's fine, go see your therapist, like, this is, you have nothing to worry about, you know, whatever the situation is. And it just creates then actual anxiety about coming into a doctor's office and asking for help, and like actually seeking that help. I love how someone just said 100%. 100%. But yeah, like,
a lot of people are saying they could relate for sure.
Yeah, like coming in and saying like, I don't feel well, but everything comes back normal. I tell people, like, that's where we live. That's where like C infancy lives. Like, my blood work comes back normal, right? But or my testing comes back normal, and it's like more so maybe we just need to tighten those parameters and then address it. And someone just kind of asked about neurological rehab, but your brain can change its own function, and it's the only organ that can do that. So it's amazing, and it needs certain things in order to change its function. And when you're doing specific and targeted rehab to do it, then we're reteaching the brain whatever it needs to be retaught, whether it's going against gravity with dysautonomia, whether it's perceiving your environment through your vestibular function, whatever it is, we can reteach the brain through rehabilitation so that they're not having those symptoms anymore. So it's pretty neat.
Totally. Yeah. And on that note of kind of just like the brain being so powerful and amazing, and I like to tell clients too that when we're working on anxiety, is like neuroplasticity. You know, when it comes to changing your thoughts, it's like, just like you can do that neuroplasticity with that type of vestibular training and all of that, like you can actually do that with your thoughts. And
yes,
I have a lot of people that have been struggling with anxiety for many, many years, and maybe they haven't received like a type of treatment that has worked for them, and they kind of think that that's just it for them, and they have to just live that way. But there's so much research on neuroplasticity, and for those that don't know, that basically means that like you can change the way that your brain has been behaving. So if you've been having all of these continuous negative thoughts and you've been feeling extremely anxious for a really, really long time, it's actually possible to rewire your brain so that you're no longer thinking that way, no longer feeling that way and acting that way. So I like to just tell people that so that they can have some hope, and they can know that like physiologically you can actually change the way that your brain has been functioning.
Yeah, it's not their reality. Like, that's a phenomenal example. I tell people all the time, like, there's no difference between learning how to drive and a thought, or like what we're doing in here. Like, it is a series of chemicals and ion transmission through your neurons. So I don't want to get too nitty gritty with that, but like, it's a series of messages that are passed through the brain for it to change its own function and learn. And there's no difference between a thought versus learning to drive your car or doing it here. But one big principle of neuroplasticity is specificity. And that's where this kind of changes, where it's coming from different providers is, you know, if you're working on thought processing, that's like what you're doing with people and doing things in real time to retrain the brain during that process or during that scenario. When we're talking about like vestibular and autonomic, we're actually taking them through vestibular input and changing the brain's function in real time. So we get very specific. And so that's where I say there, you know, there's no difference between learning these things because your brain's going to learn it, but there's a difference between application and like how this becomes effective for each person, and having I think this is the big one, having an individualized approach for your case. Like that is the most important part of all of this, is someone needs to look at you both from a psych perspective and a physiological perspective, kind of toss everything out for a second and just look at you as an entire human and take that individualized approach and say, this is what's actually happening, versus let's just label you with a diagnosis or let's just label you with some blood work. Like tell my patients there's so much more than just, you know, a set of eyeballs and some blood work, and there's so much more to that. So,
Totally.
love that.
Totally.
Love that.
Yeah.
So I'm curious for you to share, what are some of the techniques that you use with your patients to help with that physiological response, especially with our viewership, who we teach them how to address the physiological response, but like in real time as they're, you know, addressing their anxiety or addressing these anxiety like symptoms. What do you teach your clients and people to do in real time?
Yeah, so kind of to help like manage it in the moment.
Yeah.
So depending on like, let's say if it is just anxiety, let's say we've ruled out there's nothing else going on medical, then I really, really try to teach them, you know, that like it's going to pass. Anxiety always passes, especially from a physiological standpoint. Like if you're having a panic attack, it is not going to last long. And the best thing you can do, as weird as it sounds, is just welcome it and accept it, and just accept that you're feeling anxious and that it's okay to feel anxious and that you don't need to push it away, because the more that you push it away, the more that you resist it, you're sending that threat to your brain, and then it's going to feel more anxious, and it's going to actually make the panic attack last longer and actually make it more intense. So if it is just pure anxiety, I teach my clients that even if it's really, really uncomfortable, it's not dangerous, you know, and you've gotten through it before, you can get through it again. I'll do a variety of different techniques. Like I'll teach them how to do something called exposures. So that's basically exposing yourself to the thing that is creating anxiety. And typically we avoid the things that create anxiety. And then that over time will just make the anxiety become even higher. So I'll kind of do that in like a very kind of controlled and safe way. And over time, the more that you're exposing yourself to those triggers, eventually you're teaching your brain that it's actually okay to be in those environments. It's actually okay to do those things. We don't want to be avoiding those things. I also will teach them to kind of examine their thoughts about the anxiety. I'll do some like CBT type techniques, kind of figure out, you know, what are your thoughts that you're having, and we'll kind of break those down and see like, are those actually logical? How can we reframe those to like serve you better? And then I also like to use something called acceptance and commitment therapy. So that's basically like, regardless of what you're feeling, regardless of what your anxiety is like telling you to do, you're going to go and live in alignment with your values anyway. So like if a big value of you is to have social connection and you have social anxiety, your anxiety is going to tell you to isolate, and it's going to tell you to avoid social interactions, but we're going to have you go do those things anyway, because you want to be taking values driven actions rather than emotional driven actions. Because our emotions, if we let our emotions run the show, then like we're never going to get to where we want to be when it comes to anxiety. Like I just posted something recently of like, thoughts are not facts, you know, and it's the same thing of like your emotions are not facts either. Like we have emotions all day long, every day, and emotions like are flowing through us, and we don't have to really give them any meaning. Like sometimes they just happen and you can still go about your day anyway. So those are kind of some of the ways that, like, let's say if it's not a medical thing and it's just anxiety, those are some of the ways I work with them with that. But if there is something medical going on, then I find that it's really, really important to just help them like find hope, and help them just remember that like it is possible to get through whatever this medical thing is that they're dealing with, and that they can still live their life anyway. And a lot of the time we work through kind of some of the thoughts of like, you know, it's not fair. Like, why is this happening to me? Like, things like that, which come up a lot with health things, which like I can personally relate to. So I totally understand. It's really frustrating to go through health things. So we'll just kind of talk about like, how can we help you still live your life to the best of your ability during this difficult time while you're receiving treatment, and finding some hope that, you know, we can get you back to baseline. We can help you get back to like physically and psychologically back to a place where you want to be.
I love that. I love that. Yeah. I mean, that is, other than like the direct approach with anxiety, like that is a lot of what we try to do on our end, is give the patients the reason why this is happening. Mm-hmm. Like that's like the biggest thing. I find everyone just like wants that answer as to what that, like why is this happening to me? Mm-hmm. And we are uncovering the root cause from a physiological standpoint, like why is this happening? And it's more than just a brain or just hormonal systems. It has everything to do with, it's everything. It's toxin exposure, it's immune function, it's genetics that are at play, it's everything. And so looking for providers, for people who are like kind of tuning in, like looking for providers who look at you as an entire person mm-hmm. is extremely important. I think that goes from, you know, both from like a therapist standpoint and obviously clinician, especially clinician, looking at you entirely and understanding why this is happening mm-hmm. than just spending, you know, 5 minutes with you. Like for our new patients, like our exam process is an hour and a half.
Yeah.
Right. That's with me and like also our other assistants and neuroassistants and other people in our office. But like we're working with people for long periods of time to really get to know them and to get to know their system entirely. And I think that's just crucial, that individual treatment, that one-on-one, all of that. Mm-hmm. So I love that.
Absolutely. Yeah. I think it's really, really important to have that.
Yeah.
Just those eyes on your case, you know, and like I'll typically see clients once a week for like 50 minutes. So it's like, that's going to be so much more helpful in figuring out exactly what's going on versus just like a 15-minute appointment, you know, where you're kind of in and out and like you're not really not much question. Yeah.
Yeah. Some in depth for people are like, well, I've never heard of functional neurology, and I like, what do you do to address and whatnot? And so the most important thing is in-depth testing. Like I always tell my patients, we don't like want to throw spaghetti to the wall and hope it sticks. Like that's like something I say often. It's because we're trying to be strategic. So I always all of our doctors throughout our offices always spend time with our patients to understand what symptoms are they experiencing in addition to their anxiety, and what does that, like in just saying, oh, I have anxiety, well, what does that mean to them? Like, what does that experience look like? Because that can often really tell us like what's happening. And we go through questions about hormones, questions about thyroid, blood sugar management is massive for this. We talk about past traumas, obviously up to their comfort levels, even physical traumas like concussions, physical exercise, everything in between, to understand like, well, where's the dial pointing? And then we do our neurological exam to understand now what's happening in the brain. What is like the accumulation up to this point, or what have all the series of events led to for the brain to be operating this way. But then to kind of go a little further, we run full thyroid panels on our patients. Like every single new patient that runs through our door that comes in, we do a full thyroid panel with antibodies to understand, like the example you used with your aunt, like how is the thyroid functioning? And there's so much more than just like TSH, T3, and T4. Like there's so much more. There's like 5 other or more levels that show how the thyroid metabolism would be going through the body. If it's needed, we'll do adrenal testing. If we need to rule out a pathology, we will do blood. But if we need to look at the functionality, like if you're noticing your anxiety is at a specific time during the day, or you're waking up always in the middle of the night between like 1 and 3 a.m. with a panic attack at night, or you notice like your anxiety revs up at night and your brain's going, you can't sleep, you're waking up exhausted, like that might be more blood sugar, cortisol imbalances. So we'll do adrenal testing through saliva testing, preferably with that. And then we do like in-depth hormone testing as well, using usually urine. It depends on the patient and like what we're trying to test for. But I always tell, especially for like my cycling females, like to run blood work on one day of the month is really pointless.
Yeah.
Because you have a 28 to 32 day cycle. There's a lot more that happens during that cycle. So for some women, they need a full month of testing of their cycle. Sometimes they need like over the course of a couple days. So we utilize different testing for that. Serotonin is a massive neurotransmitter that helps with anxiety, and a lot of it is mitigated in the gut. Most of it actually is. It's less in the brain, more so in the gut. So if they're having long-standing constipation, long-standing diarrhea, long-standing upset tummy, bloating, digestive problems, acid reflux, you name it, it's not normal. It's common, but not normal, and we need to like explore further. So our exam process like really dives into all these various systems to say like, well, for you, what do we actually need to address? And then obviously the big need of it is the brain, because your brain ultimately controls all of that. And is there any additional things like mold or environmental toxins or viruses or anything that has caused the brain to react this way?
Totally. Yeah. That's so helpful and just so much more in depth than I think a lot of people have ever really even been offered.
Yeah, that's what we try to do.
Totally.
That's
yeah.
For people kind of tuning in, like, what should they look for on your standpoint? Like, what should they look for when they're looking for a therapist? Obviously, you're certified in multiple states, which is awesome. But I don't know, can you give any suggestions on like when people are trying to find a therapist that works for them, or things that they should be recognizing and maybe choosing accordingly?
Absolutely. Yeah. So a really great, like, if you're looking for a therapist, obviously you can work with me if you want, if you live in one of the few states that I'm licensed in, but if you're not, then you can look for one in your own area. So a site that I really recommend that I really like is on psychologytoday.com. And you can kind of filter out, like you can give them your zip code, you can filter out your specific, what you want to work on. So I would say, especially with anxiety, like try to find a therapist that really has additional training in anxiety, because I think anxiety, like, unfortunately, I think all therapists say that they kind of just like work with anxiety, but I've had so many clients come to me and be like, yeah, I've gone to therapy for years. I'm like, it's never helped my anxiety. And then like, we'll kind of try some different interventions that they've never done before. And they're like, okay, this is actually helpful. So I think it's really important to find somebody that has that additional training in anxiety. So, if you have trauma involved, I really recommend working with somebody that is certified in EMDR. That's a type of like body-based therapy that I really, really recommend. I use it in my own practice. It really works on the brain on like a deeper level than just talk therapy does. So that can be really great. You can also look for a therapist that's just trained in somatic therapy. So those are other different types of like body-based practices that can really, really help with the physiological effects of anxiety and past trauma. So yeah, just really looking for somebody that like actually has a lot of understanding into what you're going through. And most therapists will offer a free like 15-minute consultation call. So I really recommend utilizing that, telling them exactly what you're going through and like making sure that they know how to help that they specialize in that. And also making sure that you feel comfortable. Like that's like the number one most important thing in working with a therapist, is making sure that you feel like you can open up to them, obviously, because otherwise what's the point? And making sure that you feel comfortable to be yourself, making sure that you guys click. You obviously don't have to be like, you don't want to be best friends. That's like blurring the ethical lines, but you want to make sure that you feel comfortable. Like that's like the number one. They've done so many studies on like what is the number one indicator of success in therapy, and it's the therapeutic relationship. It's like you need to make sure that you actually have a good therapeutic relationship. So I would say shop around if you have to, do multiple consultation calls until you find a therapist that you feel like you connect with.
I love that. Is there like specific certifications or like additional training certifications that are like, someone can read on like a practitioner's bio and they're like, oh, like that's what that means and that's fantastic? Or...
Yeah. So it depends on what, some therapists will put it all out there, some won't. So if you're a certified clinical anxiety treatment professional, that's like additional training that you can get. I've done that training. That one really goes super deep into the like physiology behind anxiety, like what's going on inside the brain and like how to really treat that in many different ways. I find that therapists that are trained in exposure therapy, that can be a really, really helpful one for anxiety. Like I mentioned, EMDR and acceptance and commitment therapy is also a really, really helpful one. I think that unfortunately, a lot of people have seen therapists that are like only trained in like thought examining, like CBT typed therapy, which I think can be very, very helpful. But usually when there's extreme anxiety involved, usually it's going to take more than that. So I would say like looking for somebody that also has those additional trainings.
I love that. I love that. And for people on the functional side, at CFNC, we do treat individuals all over the world, all over the US, all over the world. We have patients fly in for treatment. We have patients travel from near and far for treatment. But if that's not an option, we do suggest like looking for a chiropractic neurologist or a functional neurologist in your area. You can go to acnb.org. This is the board certification accreditation for chiropractic neurology, and you can take a look and find a doctor locator. And obviously, kind of like what Sarah said, like, you know, see if they will do like a consultation. We offer consultations for our patients as well, 15 minutes, to see like, would you be a great fit for the office, or do you have additional questions, or like, what does treatment look like for like your type of case? And I think that's so important for both the patient and the doctor to make sure, like, yeah, like if you're going to come all the way here, or yeah, you're going to spend time with us, like it's going to be a great fit. And, you know, same thing, I would try to, you know, reach out to those doctors and see, or their offices, and see if they have that ability or service that you can maybe, you know, either it's complimentary or pay a small fee, just to like ask some questions and get to know, like, would they feel comfortable treating your symptoms, and what do they think it is, and do you think it's a good fit? I think that's incredibly important.
Absolutely. Yeah, that's great.
Oh, great.
Cool. Well, should we open it up to see if anybody has any questions? We have about like 9 minutes left.
Yeah.
We can see. Did you have anything you wanted to touch on before we do that?
No, I think that's great. Yeah, if anyone has any questions at all, please drop it down right now. If maybe we can't think of any right now, we just kind of want to marinate on some of the stuff we talked about, like, please feel free to reach out to both of us on our socials. We'd love to do this again at some point, and like maybe we do separate posts to discuss them or whatever it may be. But yeah, drop us questions or reach out to our offices and we can get you on the right path. But kind of looking through there.
Let's see.
Let's see.
I'm still totally learning how to do Instagram Live. Talk Live, so I'm like, are there any questions like anywhere that I don't see them? I'll just kind of speak to like some of the things that people have said in the chat. Somebody mentioned that they use like Wim Hof breath work and ice baths to help with their autonomic dysfunction. That's awesome. Those are definitely some like some somatic techniques that you can use. Somebody else said that they use IFS. That's a type of therapy that can be helpful for anxiety. It can be helpful for trauma. So yeah, I think it's just like the most important thing is that it's so like individualized, you know, it just like, it depends on the person, and like everybody's going to need something different. And like one type of therapy or one type of like treatment might work really, really well for one person and not well for another person. So I think it's really important for people to have options and explore those options.
It is. It can also be very frustrating, but I think it's also real. That's when you just get a practitioner who can look at you as a person and get you that individualized care, and then that process gets a lot quicker or seamless, I should say, instead of like, you know, trying all these different things.
Definitely.
So
okay. But what are some of the steps you take when addressing anxiety? Are there any across the board methods you find yourself using with many patients? I'm not sure if that was directed towards me or towards you, so we can both answer it. Do you want to go first, or do you want me to go first?
First and foremost, when it depends on when that anxiety is occurring. So if they're like, I go into Target, or I go into a Costco, or I go into like a Bed Bath & Beyond, and I immediately get anxious, the first thought in my mind is there's something vestibular happening. So I want to rule that out during an exam. If they're like, I'm just sitting on the couch and all of a sudden I'm anxious, or my heart's racing, or every time I stand up I'm getting dizzy, or I can't stand for prolonged periods of time, I'm really curious about their autonomic function. And those can also be within the same individual experiencing both things, not trying to say that it's one or the other. It could definitely be both at the same time. If someone's like, I'm waking up in the middle of the night and I'm startled out of sleep, or I'm dragging first thing in the morning, I'm relying on caffeine to get going, which then may make some anxiety worse, or falling asleep during the day, zoning out during the day, or having higher anxiety at night, or, you know, feeling more energized, not just anxiety, but just energized in general at night. This is not normal. is common, but not normal at all. This tells me more adrenal related, more blood sugar regulatory related, and it could be directly being affected by like vestibular function. So people can have multiple things at play causing those symptoms. But those are kind of some of those things that I hear that I'm like, we got to make sure we're checking out that. We might need to be checking out this. Like those are kind of the things that, make that like ding ding noise in my ear when I'm asking my patients their histories.
Definitely. Yeah, that's great. I think that's super important. And some of the things that I do, I always start with all my clients. I always start with doing like a super in-depth assessment because like I said earlier, we want to determine, is this purely anxiety? Is there something else physiological going on? So I'll ask them, like when the anxiety started, are there any specific triggers? Like, is it random? We'll do a lot of kind of like looking at the thoughts that they have around the anxiety, because anxiety can be so uncomfortable that it can feel scary. So a lot of people feel like, when they're feeling anxious, like they need the anxiety to go away immediately, or when they're feeling anxious, like it's not okay to feel anxious. Sometimes people feel embarrassed about it or ashamed about it. So we do a lot of deep diving into like looking at those thoughts, helping them to reframe them, because the reality is it is completely okay to feel anxious, and let's say that there is nothing physiological going on and you're a human just experiencing anxiety. That can be completely normal and that can be completely okay. So kind of giving themselves permission to like feel all of their feelings and still like live their lives anyway. And, learning how to go about their lives, even if they have anxiety. There's a lot of people that they feel like if they have anxiety, then they can't live a normal life, or like they can't do all the things that they want to do unless the anxiety goes away. But the truth is you can still totally live a fully functional, fully normal and fulfilled, happy life, even if you're feeling anxious. And the more you push yourself to just go out and like live in alignment with your values, the less anxiety you're going to have over time. And it just gets so much easier over time. So those are kind of like some across the board methods that I'll use with people. But like I mentioned, I'll tailor it depending on the client. But it all really comes back down to like believing in yourself to being able to still do these things that you want to do, living in alignment with your values, and a lot of psychoeducation about, like how anxiety is not actually dangerous. And like, even if it's uncomfortable, it's not dangerous. And it's okay to still go about your day-to-day life, even if you're feeling anxious.
Yeah. We got a question. Sarah, what states are you licensed in?
California, Florida, and Utah. And I do telehealth. So I see all my clients virtually. And if you're interested, I have a consultation call link in my bio, like we were talking about. You can speak with a therapist briefly just about your specific situation. So if anybody is interested, I do have a couple openings.
Cool. And then someone says, lately some anxiety I experience has been caused by bladder pelvic floor issues. This is new to me. It feels abnormal. My primary care is brushed off. Have you heard of this? Either of you? The answer is yes. Mm-hmm. I have heard of that. I've had patients with that before or very similar. And now this is very broad. So, this we'd have to kind of understand more of like, well, what type of issues and like what is happening. But your brain ultimately controls like your bladder, controls your pelvic floor muscles, like conscious control and unconscious control. Your brain has that power to do so. And so if you're having also anxiety, again, this is where further investigation has to take place to understand like, why is this happening for this individual? And I appreciate that they felt confident enough to bring this to us on here, but this is where I say like, we need to take a closer look to understand how your brain is functioning. Is there any other metabolic reason? Are you dealing with any infections, like bladder infections, anything of that nature? But in addition to, how is the brain ultimately functioning? Because you have spinal cord reflexes and other reflexes in the brain that control how we control our bladder. So it's like, this is important, especially in our pelvic floor. So very important. I love that question. It's definitely a little different than what people may think of anxiety, but if they're noticing like these two things that are together, like I'm having these issues and anxiety, they're probably related. So I love that.
Totally. Yeah. And I post a lot of content about like anxiety can cause like all of these different symptoms that you might have had no idea that they could actually cause. So I have had some clients that have experienced that. I've heard of that before. Like when your body is in that sympathetic fight or flight state, it actually is more common to feel like you have to like pee more often or go to the bathroom more often because your body is just pumping out so many stress hormones, and that can cause so many different symptoms. So definitely.
Well, awesome. Well, I love this. This was so much fun. I love this topic, and I'm glad everyone could like come on and participate and ask questions. So thank you so much. If you guys have any additional questions about this or about what CFNC does or about Sarah's work, like please feel free to reach out to our offices or social media. Like we're trying to be very present and try to make information as accessible as possible to you guys, because we believe that giving information, giving education to our patients is power, and making sure that you guys know that there are doctors out there and physicians and therapists and health professionals that are your advocate. So thank you so much, Sarah, for helping figure out this Instagram Live.
Yeah, for sure. Thank you so much for inviting me, and thank you everyone for joining. Like Bianca said, if you have any questions, feel free to reach out to us.
Awesome. Thanks, everyone.
Thank you. Bye.
Bye.